Coming up next on this episode of Best Docs Network featuring Forest Park Medical Center, Dr. James Davidson, Dr. Richard Hahn, Dr. Ricardo Meade, Dr. Yoav Hahn,
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center, which is one of the top medical centers in the entire Dallas-Fort Worth area.
Indeed it is, Jim, and this is a whole show dedicated to Forest Park Medical Centers and all of their fine physicians.
All right, let's get the show going with our first Forest Park physician, bariatric surgeon Dr. James Davidson.
Why are people becoming more obese? Well, there's two things there. Is the culprit the knife and the fork, or is it the chair? Well, one of the things is that they've done studies, and they've shown actually our amount of food intake is decreasing or staying about the same since 1950. But what has changed since 1950 is our food source. We now have foods that have hormones in them, have antibiotics in them, and we have what's called a homogeneous sort of fat supply, homogeneous sort of food, this genetically changed food. The next thing is that we definitely have decreased physical activity. One of the healthiest person 50, 60 years ago was a truck driver. Why? He loaded and unloaded this truck. Next thing is stress and distress. You think of times at World War I, World War II, people had to have a lot of stress or distress, so are we having more or less now? I don't know. Another cause of obesity in this country is drugs. It's estimated that at least 10% of all obesity is due to drugs. And what are some of these drugs? Well, particularly some of the antidepressive drugs. It affects the brain, and you change some of these receptors in the brain that give people a good feeling. So they want the good feeling more from food or what have you. One of the big things that controls somebody's weight is the brain. We all eat almost the same number of calories each year. The average American only puts on about a pound a year. How can you put on such a small amount of weight of just simply a pound or two a year when you eat almost 1 million calories a year? That's the brain, due to these feedback mechanisms from your body's sensors. One of the sensors things is the leptin, a incretin released by fat cells that goes to the brain that controls how much you eat. So it's pretty amazing how well God designed the body, that considering how many calories we eat a year, how little bit of weight we gain. The brain and the body have this fantastic feedback between the two to keep people's weight approximately the same when you consider they eat about 1 million calories a year.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to bestdocsnetwork.com.
Sleep disordered breathing, or commonly known as obstructive sleep apnea, is a fairly common, debilitating, and sometimes life-threatening condition that afflicts a fairly significant fraction of the U.S. population. The term apnea refers to the cessation or the slowing of breathing for 10 seconds or more, and is frequently noted or noticed by the bed partner as gasping or choking the patient.
My wife would say, sometimes I think you're dying, you know, and I'd ask her why, and she'd say, because you'd be breathing real heavy, and then all of a sudden you would just stop.
As this airway space narrows, and the most common reason is during sleep, the individual loses muscle tone. When that patient loses muscle tone, the tongue falls back in the airway. The procedure that I commonly perform and that was performed on Mr. New is what is referred to as the tongue and hyoid suspension. The tongue and hyoid suspension utilizes a device that inserts screws in the inner surface of the mandible. These screws have attached to it a very strong suture called proline, and that suture is placed around the hyoid bone. The hyoid bone is attached to the lower base of the tongue. This brings the hyoid bone closer to the mandible, opening up the posterior airway space. In addition, there's another suture that's passed within the tongue, and that holds the upper base of the tongue.
Now it's just you wake up, you're just refreshed because you have, gotten sleep. I noticed after my surgery, I fish a lot. When I got on a boat, the wind would go through my nose and would just be going down the back of my throat because now that passage is open, and it was just a totally different feel than you ever felt. There was lots of times when I would fish before that I'd be like, I'm just too tired to go. I don't want to mess with it up. Now it's not like that. It's like, if I got a chance, I'm going, even if it's just for a little while.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Up next, plastic surgeon Dr. Ricardo Meade has a special procedure that he was able to perform on a woman that survived breast cancer.
I came to Dr. Meade because I was diagnosed with breast cancer. I had several options as far as procedures concerning reconstruction.
I think one of the biggest challenges that I face in breast reconstruction is educating patients. It's a time of crisis for them, so it's very difficult for them to choose what they normally would choose. During the crisis, typically a patient will simply want their breast to be reconstructed as quickly, simply, as safely as possible, and just get me out of here.
DIEP flap was the way to go because the implants just weren't an option because there was always a possibility that they could get hard, and I liked the idea of it all being me.
You can take the skin and the fat from the tummy, you can take the blood vessels with it, and you can leave the muscle behind. So the recovery for those patients is much, much faster. Nancy had her DIEP flap and was up and around. Now part of this obviously is her spirit, but it's a lot easier to recover from an operation where your tummy muscle was just separated and not cut out. These patients where I leave all of the muscle, their recovery is so much faster, it's unbelievable. The typical patient is someone who has an adequate amount of tissue from their belly button down to about the level of where a C-section scar is. And if you tighten up your tummy muscles and you kind of pinch that area, that's the size of tissue that you can have for one breast. The DIEP flap is all natural, so it's a really nice reconstruction for a patient so that she no longer has to worry about the reconstruction. The recovery is about 3 weeks, and once they're done with that, they're done with their breast reconstruction for life.
I did go home with drain tubes and whatnot, but it took me about a month before I felt like I was back to fairly full capacity as far as moving around and going places.
It's a natural form of reconstruction. Once it's healed in, they're done. They don't have to worry about it any more than they worry about their tummy.
Everybody thinks I look amazing, and it's just been a very positive experience. I haven't looked this good in 20 years.
Forest Park Medical Center prides themselves on being one of the top medical facilities in the Dallas-Fort Worth area. They also pride themselves on being a good neighbor because they are very active in the community.
Today we're having the Highland Park Science Festival, and they've asked me to come speak specifically about robotic surgery. And I've had the Intuitive people and Forest Park partner together to get 2 demonstration robots so the kids can actually see what we do with a robot and kind of how we get prepared for surgery.
We have 15 students who have opted to come see Dr. Salter and actually get to manipulate this daVinci robot. I personally know a lot of these kids, and I've taught them a couple of times. Most of them are seniors, and a lot of them are interested in medicine. So this is, I think, going to be a really inspiring event for them.
The kids have absolutely loved it. They have just been full of questions. They can't wait to get up there and actually get on the machines and feel what it's like to operate the machines. So I think we've got some great minds here, and I think that if they can just be channeled into the right direction, that medicine has a very bright future, and these kids will be part of it.
We are so fortunate that members of the community feel like they need to give back to these kids, and I don't know if they really realize the impact that they have on a lot of students, because this is bringing the actual profession into the classroom. You know, it's a great event, and it's gotten bigger every year.
So much of medicine has been maligned lately, and I'm afraid we're losing our really smart kids going into other professions because of the length of training, the risk of lawsuits, all the negative things that they hear about, and they don't hear any of the positive. So I wanted to make sure the kids know there is a positive to medicine, and that if they like technology and they like to be involved in the newest stuff, this is where it's at with surgery. And we have a great medical center in Forest Park, and they like to get out and help the kids see what's available for our community. And I've always wanted to be able to get out and show the kids what they have available. And Forest Park has always been open-minded about trying new technology, new equipment. They also want to get out and show, you know, people what's available, what they can offer that's different than some of the other hospitals.
Did you know the spacious operating rooms at Southlake Forest Park Medical Center will feature the latest technology, including the ability to live stream video from surgeries to nurse stations and other Forest Park campuses? The Dallas location has an auditorium where doctors can gather to watch a surgery. Cindy, a loving mother, had a weight problem until she met Dr. Clayton Frenzel, and look at her now. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com.
I had a lap band performed by another physician, and then in 2010, Dr. Stewart did a revision to the duodenal switch because I was having so many complications from the lap band, specifically with my esophagus. I was having trouble keeping down liquids, and just eating was a problem for me. So it was really taking its toll physiologically. Revisional bariatric surgery, what is it? It actually is somewhat of a vague term. It could mean anything from trying to fix a problem. You know, someone has a surgery and they have a problem with it. They need a little help to get over that, whatever a side effect or complication or just symptom is. But it could also mean that the patient is unhappy with the results. I did significant research and found Dr. Stewart online, and I liked the fact that he offered several different weight loss surgeries, which was key for me to have a choice as a patient. I used his website to research the specific surgeries, and I felt like duodenal switch was the right surgery for me. It offered a chance for me to maintain a normal weight and also lessen the chance of regain later on down the road. When we have patients that come to see us who've had another procedure and they just haven't had good results, or maybe they had good results initially and then they've regained their weight. Our approach is going to be not to blame the patient, but to look at did the patient have the right procedure to begin with. I'm more going to counsel them about, well, maybe we need to take a different approach, and maybe that approach needs to be tailored after your particular, situation. Dr. Stewart as a person is just wonderful. He's very precise, and you can tell he's a very skilled surgeon. He explains things in detail. He makes it to where you're ready to take that next step. And his whole entire office staff walks you through the process step by step, so you don't feel afraid. You feel like you can confidently go forward.
For the last couple of years, I started having nosebleeds. They were never very severe. I went to the doctor a couple of times. We couldn't really figure out what was causing them. And then about 4 months ago, they became terribly severe and would last a half an hour at a time. And So I went to my internist who had me do an MRI and said, well, the good news is you have no tumor, but the bad news is you are not formed correctly. So that's when he sent me to Dr. Pero.
One of the newer technologies that we have over the last few years to help people with not only nasal obstruction but with sinus infections and sinus problems is balloon sinuplasty. And balloon sinuplasty has been an excellent advancement in that it is a relatively less invasive or non-invasive technique to help open up the sinuses.
I think I had just a congenital issue, and he said, I really want you to come look at your MRI. I said, but I have just a vessel, I want you to cauterize. And he goes, no, that's really not it. And so I looked at the MRI, and it all made sense because I've never been able to blow my nose on the left side. Well, it's because that left side was almost completely closed.
The way balloon sinuplasty works is if you have a sinus opening that is narrowed and usually congenitally, in other words, people were born that way, and then if they have a little bit of swelling, say in response to a cold or even a weather change or allergies, if you have a narrow opening, if it swells a little bit, it can swell shut. By placing a balloon into the sinus opening, we're able to inflate that opening and make that opening larger. If you then get the same amount of swelling from the allergies or cold or what have you, it's no longer swelling shut anymore, and the sinus can continue to function as normal.
Dr. Pero told me that he would go in and open up the left sinus cavity where it would actually drain properly and I could breathe through the left side. It was just so successful. It was shocking when I went for my follow-up visit, and he took the packing out and said, okay, breathe through your nose. And I did, and it almost felt like I had too much oxygen. It's a huge difference. Dr. Pero is wonderful, and I would recommend him to anyone.
Don't forget, for more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And you know, Candace, Forest Park Medical Center, of course, and their physicians are dedicated in helping change people's lives. Let's meet our next Forest Park physician, plastic surgeon Dr. Richard Hahn, who has been able to cosmetically help a woman that survived skin cancer.
The prevalence of skin cancer is only increasing, especially since we live in Texas, in a southern state. Just the amount of sunlight exposure is greater than, say, if you lived up north. And those who are susceptible can get skin cancers. The most common ones are generally less aggressive. They're called basal cell cancers. You have some more aggressive subtypes such as squamous cell, and then the deadly killer, which is melanoma. Unfortunately, that's more rare.
Back in 2008, I had a little spot that was biopsied and came back positive as basal cell carcinoma. When I met Dr. Hahn, he said that he would have to do a skin graft using a piece of tissue from my ear. That surgical procedure worked out really well. Scary at first, but it turned out really well. This year, in May, there was another spot on my nose.
In Dottie's case, she had a skin cancer on the tip of her nose, which is a very challenging location because there's not an easy way to just bring the edges of the defect together without creating a lot of distortion. So you're left with some of the other options. Well, skin graft on her was not a great option because of the depth of it. It was going to heal with a divot, something that had been very noticeable. So really we're left with the more complex option of doing a nasolabial flap, or borrowing tissue from the cheek, leaving it tethered to the cheek, and then attaching it to the nose. Dottie had that procedure done, and that trunk was left there for 4 weeks. She was a great patient. She hung in there. We went to that second stage. We divided it. I did some dermabrasion to kind of sand and smooth the edges of the scars, and she's only a few months out, and it's very hard to even tell that she had anything done.
Dr. Hahn is just amazing. He's like an angel. He makes you feel comfortable. He held my hand and he said, "Don't worry, Dottie, you'll look great." And I just had to trust in him. When I think about everything that I've been through, I'm very happy, very happy. I still recognize my nose and I think it looks great. Healthy nose, yes. Cancer-free, yes. I'm very pleased.
West, a local store owner, had cancer, and he credits Dr. Sharon Gregorczyk for saving his life. To find out more about West's story and other life-changing stories, log on to bestdocsnetwork.com. Now to our next Forest Park Medical Center doctor. It's Dr. Yoav Hahn, who helped reconstruct the middle ear of one young lady who was involved in a serious car accident.
We were going down a back road, and there was a group of dogs that I could see in front of me, but apparently there was one left behind, and it came out of my blind sight, and when I finally saw it, I swerved. And when I swerved, it slammed me into 2 oak trees.
When Brittany came in to see me, she had a profound hearing loss in that ear from the car accident. Something associated with the accident affected the continuity of the 3 little hearing bones in her middle ear.
When I was in the hospital bed, if I was laying on my left side, my right side I couldn't hear anything. I think there's something wrong because I could hear perfect. Now it feels like my balance is off. I can't hear y'all when I turn my head.
I tell the patient that they have an option to repair their eardrum and repair the hearing bones within their middle ear cavity. And I go over with them the anatomy of the middle ear, and I talk to them about the fact that a surgery can be performed to look into the middle ear, see what the problem is, and at the same setting to repair whatever it is.
Dr. Hahn knew exactly what he was doing, and he was taking it one step at a time. He wasn't, okay, well this is what we need to do and then we need to do it now. He was doing it step by step by step. And the first step that Dr. Hahn took was taking an ear test. And when he had found out how bad the results were, that's when we started taking more steps towards getting surgery done.
I lifted up her eardrum, looked into her middle ear, and it was apparent that the 2nd hearing bone had actually been misplaced off of the 3rd hearing bone. So there was no connection between the 2nd hearing bone and the 3rd. When her eardrum would vibrate, it wasn't vibrating into the inner ear at all. We actually replaced her 2nd hearing bone with a prosthetic hearing bone, and within days, she noticed a significant improvement in her hearing.
Amazing the results that I had, and ever since after the surgery, I mean, I've been just upscaling from there. If I knew someone who was having the same problem as I was, I would definitely recommend Dr. Hahn. He's a great physician, and he treats you like you're a person and not just another patient.
Today's Ask the Doctor comes from Sarah. Sarah has a question for Dr. Richard Ha. If I do liposuction, will I gain more weight in other areas?
Liposuction is permanent removal of fat cells, but you're not removing all the fat cells in the area that you treat. So what liposuction does is give you a relative reduction of fat in an area relative to any place else. Let's just say that I have 100 fat cells in my tummy and 100 fat cells in my thigh, and I've taken away 50 of them through liposuction in my tummy. I have a new ratio. Instead of 1 to 1, it's now 0.5 to 1. Or it's twice as likely that I'm going to gain fat in the thighs as opposed to the tummy. So if you take in more calories, where is that weight going to be displaced, or where is that fat going to go? It's going to go preferentially to the thigh than to the tummy. Liposuction itself is not the reason that you're gaining weight or fat in one area. It's because you're taking in more calories.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Erin's a lovely 27-year-old who struggled with her weight pretty much throughout her entire young adult life. And so after lots of different things like diets that exist and diet pills, she was not able to lose weight.
Before I came to see Dr. Kim, I was starting to have some health issues. I had thyroid issues, I was borderline diabetic, and I was ready to do something about that before they became major health issues. I was already starting to take medications that I didn't feel like I should really be on at my age.
Erin and I sat down and chatted about the different options that were available for her. She chose gastric sleeve surgery.
This is awesome.
And this was a great fit for her because she has a very active life.
What really drew me to this sleeve surgery was that there was no device that would be implanted into my stomach. and it was not as extreme as the gastric bypass.
The operation allowed her to lose a tremendous amount of weight. In a year, she lost almost 100 pounds, and she was able to then have a life that everyone wants to have as a young person.
Once I started seeing the results, I was really motivated to keep going and to keep eating healthy and to keep going to the gym every day, and just mainly the results are what really keeps you going.
Sleeve surgery, though the operation does entail physically reconstructing someone's stomach, what a patient is required to do after surgery would be nothing different than what other people are expected to do, which is to practice portion control as well as wise nutrition choices and trying to get some exercise every day. And when they do these practical steps along with good sleeve surgery, patients can do marvelously well.
When I go shopping, you know, people are actually interested in helping me. The people in the stores now, they're more willing to help me. They pull clothes for me, and shopping is fun. I don't have to go to specialty stores anymore, and I can wear heels. Before I could never wear high heels, and shopping is just a lot of fun for me now.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com.
I was diagnosed with fibromyalgia 5 years ago, and I was experiencing chronic pain, exhaustion that wouldn't go away. I actually met Dr. Baek through his wife. Somehow the conversation that I had fibromyalgia came up, and she said, my husband is doing a new study. It's called a PSTIM. And I was like, and she explained that it was for chronic pain, arthritis, fibromyalgia. It was FDA approved.
What is nice about PSTIM for patients is that there is very little prerequisites required to place this on. Outside of the contraindications of pregnancy or pacemaker, any candidate can benefit from PSTIM.
He installed it right there, and there was no drugs. I drove myself there, I drove myself home. Within 4 minutes of him putting it on, my headache started decreasing, and my pain started to ease up. And by that evening, I just felt great. And somebody said, you just look happy. And I was like, well, I'm not suffering from that chronic fatigue and that chronic pain.
There is a lot of skepticism initially with using PSTIM, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. So I took the initiative to talk to the distributor and made plans to be trained in the use, and that's how I became the first physician in Dallas to be licensed to use this device.
And my husband's gotten his wife back. My children have gotten their mom back. I don't complain. I'm happy. I feel great, and I'm really excited about it.
What I find rewarding about PSTIM is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, which of course is one of the top medical centers in the entire Dallas-Fort Worth area.
It certainly is, Jim. And for more information on any of the fine doctors that you've seen on today's show, just head to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And like always, if you have a question or comment for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com.
That's right. So long, everyone. We'll see you next week.